Hello, and thank you for taking the time to view my presentation. Today, I will be presenting findings from a narrative literature review poster that explores the impact of simulation-based learning, particularly high-fidelity simulation, on undergraduate nursing students' self-confidence in delivering palliative care and end-of-life care in acute care settings. As patient complexity increases, particularly with aging populations and chronic illnesses, nurses are increasingly called upon to provide quality palliative care and end-of-life care. Yet many new graduates report feeling underprepared, anxious, and lacking confidence in this area. The increasing demand for practice-ready nursing graduates has put pressure on nursing education to evolve. For undergraduate nursing students, a well-documented theory-to-practice gap and low self-confidence in providing palliative care and end-of-life care leaves students feeling underprepared, which can compromise quality of care, which highlights the needs to enhance palliative care and end-of-life education in undergraduate curriculum. Practice readiness encompasses technical knowledge, personal characteristics, professional skills, and attitudes. Traditional clinical placements, once the gold standards, often don't provide consistent or sufficient exposure to these types of care, particularly for diverse populations. This highlights the need for innovative educational strategies that build confidence and competence before students transition to practice. Simulation-based learning has emerged as an effective teaching and learning approach that offers a standardized, controlled, and immersive learning experience to practice hands-on learning of technical and non-technical nursing skills. It bridges the theory-to-practice gap and addresses limitations of clinical placements while fostering self-confidence, teamwork, critical thinking, knowledge reflection, and high level of learner satisfaction. High-fidelity simulation is particularly effective in palliative care and end-of-life care education. It supports a high degree of realism through advanced mannequins and technology. Kolb's experiential learning theory is the theoretical foundation that simulation-based learning is deeply rooted in. It provides structure for simulation-based learning, experiential learning as a continual cyclical learning process composed of stages. For optimal learning, learners must visit every stage. However, repetition is encouraged, and it is not necessary for learning to be in a cyclical format. The Canadian Association of Schools of Nursing Framework is an educational framework that guides the goals and outcomes of simulation-based learning as a component of undergraduate nursing education. The methods for this literature review was a structured search that was conducted in PubMed and CINAHL using relevant key terms. Initial searches yield 3,000 articles. 9 peer-reviewed articles met the criteria for inclusion, and findings were analyzed using the CASN National Nursing Education Framework as a guide. Limiters were used to narrow the search, as well as a detailed inclusion and exclusion criteria, which is on the poster. For the results and discussion, the literature strongly supports simulation-based learning, particularly high-fidelity simulation, as a teaching and learning tool to support improving learner self-confidence in palliative care and end-of-life care. Key themes were established that aligned with the CASN framework. Critical thinking. High-fidelity simulation enables learners to practice complex, high-stakes decision-making in a safe environment, thereby improving judgment, critical thinking, and reducing anxiety of learners. Communication skills are one of the most challenging skills to teach, yet one of the most essential skills for effective palliative care and end-of-life care. Learners enhance their ability to navigate emotionally charged conversations with patients and families following structured tools such as SBAR, combined with realistic scenarios supporting the development of therapeutic communication in simulation-based learning. It supports the development of psychomotor and technical skills by providing realistic, hands-on practice for skills such as physical assessments, symptom management, postmortem care, and documentation, thereby enhancing readiness and confidence in these areas. Simulation-based learning supports opportunities to practice complex patient care scenarios and skills in a controlled environment with real-time feedback. Simulation-based learning supports the development of cultural competence in palliative care and end-of-life care. The scenarios that reflect diverse populations help learners develop ethical sensitivity that respect for varying values, which is crucial in palliative care and end-of-life care. Professionalism and practice readiness is supported by simulation-based learning. Learners report stronger professional identity and emotional resilience through repeat exposure, reflection, and peer support. The importance of the 3 phases of simulation learning were also highlighted in the literature. All 3 phases, pre-briefing, Simulation and debriefing were found to be essential for reflection, skill development, and confidence building in simulation. Despite the benefits of simulation-based learning, it has its barriers, which are inclusive of cost, limited resources, and the need for trained facilitators. A highlighted limitation is that there is a lack of Canadian-focused research in these areas, as well as inconsistencies in frameworks in the literature, which can limit evaluation. In conclusion, integrating simulation-based learning, particularly high-fidelity simulation, across undergraduate curriculum is an effective strategy to build self-confidence and prepare undergrad nurses to deliver high-quality palliative care and end-of-life care that bridges the theory-to-practice gap. Future research is suggested focusing on early introduction of high-fidelity simulation in undergraduate curriculum and evaluating the effectiveness of high-fidelity simulation during the first year of practice in an acute care setting. Overall, simulation-based learning contributes to producing confident, competent, and compassionate nurses who are better equipped with skills to meet the growing demands for palliative care and end-of-life care in acute care settings.